When it rang in 9:45, they had to be in their rooms. When it rang at 10 o'clock, they had to have lights out. And when it rang in the morning, they had to be up and about. Now that tower and that bell was there for nearly 100 years until the towers began to deteriorate and it was decided to remove them for safety concerns. So when they removed the towers, they at least had the foresight to save the bell. And since August of 1954, this bell has been here in this structure, which we have here before us. Now at the same time that was being taken down in the 1950s, another bell was being created. The National Mental Health Association, as you know, for centuries, those considered mentally ill were chained with shackles around their arms and ankles. And the Mental Health Association in the early 1950s issued a call to all asylums as treatment began to improve. And they said, send us your iron chains and your iron shackles. And they collected them and they actually melted them down at a foundry in Baltimore, Maryland, and turned it and cast it into the bell which you're waiting for today, the Bell of Hope, the mental health bell. Now this bell is located in the National Association headquarters in Alexandria, Virginia. We recently learned that that bell, which is only rung periodically during momentous occasions in the history of mental health, was recently rung on September 15th of this month. The National Behavioral Health Council met in Washington, D.C. to review federal health care policy and to meet with their legislators to advocate for improved care and services for the mentally ill. So this is an evidence of the fact that the struggle continues as we seek to cast off the invisible chains of misunderstanding, discrimination, and stigma that continue to bind people with mental illness. On that mental health bell is this inscription, which you should all be aware. It reads, "Cast from the shackles which bound them, this bell shall ring out hope for the mentally ill and victory over mental illness." Today, we're going to let our asylum bell ring out this same hope. To my knowledge, since this was placed here, this bell has only been rung once before, last year during a Emmaus Mental Health Month celebration. So I'm going to invite anyone who chooses to step forward and in memory of whoever, ring the bell once in their memory. So please feel free to step forward.